It's either that or a reflex response.
What happened?
Okay. This is Dr. House. House, this is Karen.
Pleasure's all mine. What happened?
I mean, so did the conduction pin.
She flinched.
She flinched. Did you hear?
Does that mean I'm getting better?
How big is a flinch? Bigger than a twitch? Smaller than a spasm? You smoke?
Socially, a lot.
You do yoga and you smoke.
I know it's hypocritical,
Not
but
at all. The world sees your legs. No one's checking out your lungs.
How would smoking cause?
Wouldn't. Just needed a lighter.
House! My God!
The case was looking so promising.
Hey, I'm not faking.
You moved, therefore you can move. Get this lunatic out of here before she bores again.
I'm not faking!
Relax. I'm not gonna burn you again. I'm going to stab you! Look, either you're faking or you've got a pleural effusion. That's a buildup of fluid around the lungs, which is very serious, and I would have no choice but to stab you in the back with this needle and suck all the fluid out of you. So?
We should give her a local.
That would defeat the point of me being nasty. Ready? Down.
She can't breathe if she's down.
Down. She can't. Down, down, down! Come on!
That's not a pleural effusion.
Problems in her heart.
Can't fake that.
House, you're not...
I'm not an idiot. Oh,
House, leave her alone.
close her up. You wanna know why?
The room's no longer sterile.
True. That's not the most interesting reason. That is not a sexy big toe. You would never put that in your mouth.
What the hell does that got to do with it?
Told you it was interesting. It gets even better.
Scurvy.
Yeah. Drink.
Like what sailors get when they don't eat right?
Aye, aye. Your arms and leg tissues are choked with blood. Makes it hard to move. Also damages your hair and toenails.
But I'm on this great diet. Lots of protein, lots
Oh,
of...
vitamin C. A drink.
Thank you. And thank Dr. House.
You can send him a note.
I think I should start smoking again.
You want a medical opinion supporting that decision?
The symptoms started as soon as I quit.
Symptoms meaning diarrhea. A lot of diarrhea.
10 or 12 times a day. It's really embarrassing. I'm a flight attendant and
On the upside, my hiccups are gone.
You went to his group.
Well, you were the one who was all, Greg, you need to confront your feelings.
That was 5 years ago.
I've been pissy.
Fine, you don't want help? Does that mean nobody should get it?
Mark's looking for help because what? He's resentful, overwhelmed? I'm asking because I care.
Not about him. You still want to jump me, so you don't care whose marriage is in
Listen,
the way.
I can get my rocks off anytime I want. What I don't seem to be able to do is my job without you hanging over my shoulder. How many packs?
a bit over one a day, but there were lights and I quit. You used to go out with her?
Yeah. What was I thinking? I'm talking about the gum you're chewing to replace smoking as an oral fixation. How many packs?
6, maybe 7.
I'm trying to protect you. Cuddy and I may be the only people stopping you from jumping off a cliff just
pissy.
to prove that you're... Oh, I am angry.
Pissy. You only get pissy when you're frustrated.
Shut up.
Okay, I'm wrong.
This is unbelievably difficult for Marc, which you should know, which you should be able to summon up some level of empathy for.
Right. The Cripple Boys. We should start a band.
I have a good thing with Marc. We are handling this the best way we know how.
And none of this has anything to do with me.
No, nothing, except that you can't or won't just let it go. Let it go.
You're being poisoned.
By gum?
Sugarless gum uses sorbitol as a sweetener. We use sorbitol as a laxative.
He can't. The hallucination is your messed up brain's way of reasoning out a problem.
You weren't on the bus.
How do you know?
$500 shoes. Not on Princeton Crosstown.
Must be another reason why I'm here.
Yes. What do you have to tell me?
I could have had a subtle hemibolismus, indicating the early stages of Huntington's.
Huntington's would explain the abdominal pain. But it's only on the table because we're thinking of 13.
A shuffling gait could suggest Parkinson's.
Except there's no such thing as shuffling sitting.
He moved when he helped the old lady up the steps.
Who are you?
I'm the answer. Look.
A what?
Here.
You were right. I'm not sleepy, Mommy.
Me neither.
Who are you? And why are you stalking me?
Technically, you're stalking me.
What is that? Mosquito?
Maybe just a fly.
In the ointment. So there's something wrong. There's some detail I'm not noticing that's spoiling the big picture. Is this significant? Or is this dream just going in a different direction now?
Guess that depends. What are you gonna do with that?
I have to tie this around you.
I'm cold.
Stay with me. Why did I say that?
House?
Why are you here?
You believe in reason above all else. There must be a reason.
You have something to tell me.
Yes. Who am I?
It's asking, not telling. Who are you?
You know who I am.
If I did, I'd be passed out in bed instead of ODing on physostigmine on the 6th Street crosstown.
What's my necklace made of?
Resin.
Who am I?
I don't know. Why the guessing game?
Because you don't know the answer.
If I don't, you don't. You know the clues.
I know it's bugging your subconscious. What's my necklace made of?
No.
Who am I?
That makes sense.
What's my necklace made of?
Amber.
It's usually the worst on my palms and the bottoms of my feet. I get these black dots all over them.
I don't see anything.
It comes and goes.
You sure it's not just scrapes and bruises?
I I know the difference between a rash and a bruise.
Sometimes it's harder than you realize to distinguish between the two. You obviously exercise.
My problems aren't caused by my workouts.
But you do work out. And by the look of you, pretty strenuously. That's not usually the case with patients whose principal complaint is chronic fatigue and joint pain.
I was in the Marines for 12 years. I'm used to doing PT every day. Just because I can push through the pain doesn't mean it's not there.
We're not saying we don't believe you.
The hell you aren't.
We just need to be specific about what exactly the problems are.
I sleep 10 hours a night, but I feel tired all the time. I constantly get coughs, rashes, sore throats. My knees and hips feel like someone poured sand in my joints. I get these weird tingling sensations in my legs. Sometimes they're cold. Other times, it feels like my blood is boiling. Specific enough? Look, I don't care what you guys call it. Gulf War syndrome, Iraq fever, or just crappy sickness X. I just want someone to figure out what it is so they can cure it.
Hello? Is anybody out there? I think there's a problem in here.
What's wrong?
What do you mean, what's wrong? You don't smell that?
Nothing smells, John.
Are you kidding me? It's disgusting.
How long have you thought... Wait. Open your mouth. The smell's not in the room. It's in your mouth.
What's going on?
Good question.
Antibiotics should at least relieve the infection, which will reduce the odor and taste in your mouth.
Not soon enough.
All right. You're gonna feel a little burn.
You never even dipped? Chewing tobacco. Practically everyone in my unit did. But me, I was so paranoid about cancer.
Well, if it's parotid cancer, it's very treatable if diagnosed early.
My mom had cancer, which is why I know that diagnosing cancer early means before there's any serious symptoms. Certainly tastes like a pretty serious symptom, you know?
We'll know more after the test. Okay, this time you're gonna feel a little pressure. We're injecting the contrast material.
Hey, could you turn up the music?
Sure. Looks pretty good so far.
Still can't hear it that well.
Can you hear it now? John? John! John, can you hear me?
All right, ready whenever you are.
I'm ready. Wait a minute. Zoom in. I don't see it. You sure you have the right coordinates?
Yeah, she's in the right place. Go 10 millimeters above the ACPC line on the Z-axis.
10 mil above ACPC on Z.
It's not there anymore.
Are you sure you got the gantry angle right?
Yeah, I'm sure.
It's not there.
Dr. Wilson, we have a problem.
What did you do? I can't feel my legs. I can't feel my legs. What'd you guys do?
John, calm down. We didn't even operate.
This be a residual effect.
I can't move my legs.
It's not the anesthesia. John, we're gonna figure out what's wrong with you. But first we need to know one thing. Have you ever appeared in any pornos?
No, nothing. I'm gonna die. All right.
No, we're not. We should start treatment for the uranium toxicity, like you said.
But House?
Isn't here.
If House wanted to be involved in the case,
He wanted us to start this treatment. He would have told us to do it the last time you brought it up.
You have a better idea?
No.
Then we're going with Chase's. Tell him not to get the lines tangled. The infusion is slow. We can't have any kinks in the line.
I went to medical school, too.
Keep your arms on your body, above your heart. I can't feel my stomach. I don't feel anything.
Paralysis is ascending. Keeps going. We're gonna need a respirator.
What? What are you saying?
Can you breathe?
No. Not yet.
The answer was staring right at us the whole time. As plain as the nose on our faces, or the nose on his face.
What's going on? What'd he say?
No hairs and cauterization scars.
Which means?
He had it cauterized.
How could you know that?
This makes sense. Undoubtedly done to stop the same childhood nosebleeds that plagued his grandfather. Undoubtedly, because they were both born with hereditary hemorrhagic telangiectasia.
What's he saying?
I'm saying we've got a genetic disease that's destroying your capillaries.
That no one in his family's ever been diagnosed with before?
Not surprising, since the most common initial symptoms, skin rashes and nosebleeds, are often written off as a result of minor trauma or dry weather. But they can also be the result of his arteries and veins merging together. He obviously has AVM.
Yeah, high pressure and oxygen will flush the carbon monoxide from your system. This much oxygen for too long can have some toxic effects, so we'll do this in cycles.
Can I talk to you a second? You're working that thing all the time. Is everything all right? We're supposed to be watching our heart rate and blood pressure.
Yeah, I was until you pulled me over here. I'm sending out a consult on another patient.
Okay.
What? I'm not quitting my old job until I'm sure I've got a new one.
I didn't say anything.
You had a look.
Yeah, I did. Sorry.
Yeah, I think she's having a heart attack.
No, I just feel a little funny.
Tachyarrhythmia.
Call the code!
Nothing.
Big fib.
Hey, where the hell is Claire?
You crazy? You can't use those.
We're in a hyperbaric.
She's on fire!
Her heart's beating.
And we are so fired.
We've started her on nitro and blood thinners. Electrolytes and post-arrest EKG were normal. The attack was not caused by the procedure.
So what does cause synesthesia, high red blood cell count, and heart attack?
Aren't we going to discuss what caused the sudden appearance of burnt flesh? He brought charged paddles into an oxygenated room.
And you didn't stop him. Means either you thought it was a chance worth taking, making you a hypocrite, or you thought he'd fail, making you a cutthroat little pixie.
What about her liver? Original ALT levels weren't abnormal, but were near the edge.
She has patient data on her PDA.
I do not.
I saw the lab values. You said we couldn't write anything down.
I also said I wanted answers.
Liver cancer is the most likely. Paraneoplastic syndrome. We need to do an MRI.
Which brings us to issue 3.
You're saying we can write stuff down?
To you, I'm saying you're fired. To everyone else,
But you said specifically...
I hate tattletales.
She tattled on 10.
Now you tattled twice. Issue 3. Come on, let's go. We need to stress the patient's liver.
You mean make her sick?
I mean, make her sick in a specific way. If her liver is given to malfunctioning, we make it malfunction.
Are we on the other side of wrong here? Don't we have an ethics board that we should consult? Or...
I fired you.
No, you didn't.
He fired you. You're number 6.
No, I'm not. I'm number 9.
I approve of your shamelessness. You're still fired. So how do we stress her liver?
Lying in paperwork I get. Shutting down organs.
We could give her intravenous vitamin D and stick her in a tanning booth. If she goes into a coma, we know it's a metabolic problem.
Nice. Vitamin D is metabolized by the liver and kidneys. It wouldn't tell us which one's screwed up.
We could get her wasted. Give her shots of tequila, measure how long it takes for her to pass out. If it's too fast, then we know her liver's not processing alcohol. It means it's shot.
I like you, number 9. Here we are, the big moment. Which of you gets to live to be abused another day? And which of you goes home and rationalizes being fired as character building? Following numbers, thanks for playing. 21, 19, 8, 34, 17, 29, 5, 36, 2. Rest of you 8 a.m. sharp. I'll be in sometime between 10 and 3.
Can I help you? Martin! Martin! My purse is right there. Go ahead, take whatever you want.
Irene, you call me? Irene? Irene!
I'm Dr. House. Is your mom around?
Why should I tell you? They're just going to tell me I'm lying or crazy.
Not gonna do that. I really need to know what she has to say.
What do you want?
When you were young, was she...
No, not you, him.
The man in the wheelchair?
No, he's old. Actually, looks like you.
Yeah, that's Grandpa House. Tell him to call back on a landline. Terrible reception in here. How much pain was your mom in?
It's Walter.
He says his name is Walter.
You have to hold still!
I'm trying!
Damn! Hold her down!
No! Stop it!
Let me do it! Hold her down!
Irene? Irene?
You stabbed me.
You were having a nightmare. It wasn't real.
My arm is bleeding.
It's okay now. Your arm's not...
When your retina sees something, they send electrical signals to your brain. These lenses will pick up those signals.
If the signals are misfiring, it'll confirm that an old man without a medical license is smarter than all of us, that your hallucinations were caused by the...
They're not hallucinations. Tell her, Mom.
Honey, they're doctors. They must know what they're doing.
What's wrong? My stomach, it hurts.
Code an eyelid.
Lean forward, Irene. You're gonna aspirate.
I can't, it hurts. Why won't you help me?
I know what she has.
You couldn't have spoken up 10 seconds ago? You could have saved me $100.
Mushrooms weren't the only thing that got people stoned to death. Jimson weed, belladonna, mandrake root, and moldy bread. It's ergot poisoning.
You'd need damp grain there.
Completely unprocessed and untreated, like what's in that organic rye bread she's been eating. Should I be going home?
Is it 6 o'clock?
It's why she got worse on the bromocriptine. It's an ergot derivative.
There hasn't been a case in 50 years.
She kept asking for milk. Dairy products counteract the effects.
You think she knew what she had and was treating it?
Cravings based on actual needs, it's a fairly common evolutionary development. It's the stuff they make LSD from. The treatment you're on should...
So I've just been tripping?
It explains the hallucinations, seizures, delusions, constricts the blood vessels, which explains the necrosis.
She's not here.
If you don't know how to use a computer, we will teach you here. Most jobs require at least basic word processing skills. We try to get you up to 50 words per minute. We also have a course in how to talk to someone in an interview.
Stuff like what employers are looking for, how to turn negatives into positives. We can also provide clothes for the interview if you need them. People donate shoes and suits all the time.
What if I had a history with drugs?
That is nothing to be ashamed of. Many of our clients have struggled with addiction, and if you want to get clean, we'll help you do that.
And what if I have a kid?
No one to help you?
If I need someone to watch her while I'm in class or on an interview, could you help with that?
We do not provide childcare. Actually, it's something that comes up often. I would love to be able to do it, I just don't have the resources. But it's definitely on the wish list.
Okay. Okay, thank you. I'll be back.
Oh, I have to take this. Yes, please come back. We'll get you started. It was nice to meet you, Benjamin. Hey, Oscar. Oh, that is too bad. Did they tell you why? Yeah. Look, you know what? Sometimes you just don't get the job. Oscar, I gotta call you back. Benjamin? Benjamin, wait! Oh my God.
Somebody call an ambulance! Does that mean you like your new life?
If you're asking if your job is safe, that depends on what you have to say about the file you're holding.
It doesn't seem like much of a case. Although I'm sure I'm wrong.
You are. Tell me why.
Guy collapsed after being on his feet for hours on a hot day without breakfast, so that's really weird.
ER found nothing wrong. Then I decided I should test his wallet.
He's rich? That's why we're taking the case?
No, we're taking the case because no one knows what's wrong with him. And he's rich.
Ultrasound really necessary. I'm feeling much better now.
A sudden collapse at your age can indicate a deterioration in the heart muscle. A pretty serious condition.
It could also just be dehydration. Next time, you could probably drop the undercover act.
I walk in a suit and they're gonna put their best foot forward. Also, I don't own a suit.
You give away millions and you don't own a suit?
Gave those away too. You know, one day I was writing a check to my landscaper and it suddenly hit me. $6,000 to take out plants and put in different plants so I can look at them. Now, shouldn't I use that money to do something important?
And by money, you mean all your money.
I started with 10 million and I couldn't think of a reason not to give 20 or 40. I figure I could live on 25,000 a year. One-room apartment, bus pass, thrift stores, bare necessities. I still have my software company. And when I make more, I'll give that away too.
He's nuts. He's generous.
There's a neurological issue. He's getting rid of everything.
His echocardiogram was negative for cardiomyopathy. Head CT showed no signs of stroke or hemorrhage.
He has one pair of pants.
Most people with his kind of money are commissioning oil paintings of their Yorkshire Terrier. Benjamin is sacrificing his own comfort to help others.
That's because helping others is his Yorkie oil painting.
That's good, not sick.
That's naive and sick. If you really want to improve things, you do it through policy. This guy empties his pockets. What really changes?
That's right, all those babies with AIDS, they're just using us. They just got so angry, you know? So I made a terrible mistake. You know, I'm trying to start my life over. To help people, the way I always wanted. But my department got defunded and it's my fault. I just can't stand to think of all those patients going untreated because I don't have the resources to do my best work.
How about I help you out?
How do you mean?
I'll give $1 million as an endowment to the hospital, earmarked for diagnostics.
Wow. I am an opportunistic ex-con who just gave you a 2-minute sob story as step 3 in my master plan, and you've offered me $1 million, which is step 17.
Is that bad?
Ethics are not my strong suit.
It's a tough thing to control. Is there someone you want me to call?
There's someone I would like to call. She's the same person who won't take my calls. My wife. I started giving away the money. I hoped she'd want to do it with me. She didn't. I miss them. I have 2 little boys. Having a family doesn't exempt me from social responsibility.
But family comes first.
But should it? I know that sounds weird, but if someone is related to you, does that empirically make them more special? More deserving than anyone else?
Yes, it gives you a responsibility.
My boys have a roof over their heads. They're not starving. I pay court-ordered child support, and frankly, it's more than they need. I love them more than anything. I can't justify buying video games and private schools when other people's children are starving. I hope one day they'll understand that.
Your hands are trembling.
Is it the electrodes?
Are you in pain?
No. What's happening?
I'm not sure, but it's not what we thought it was.
Why do you want to give away your kidney?
There's 70,000 people in this country on the active waiting list for a kidney and less than 10,000 dead people a year to give them one.
Yeah. If only we could kill 60,000 more people a year, all would be golden.
I'll give you your money.
See? Crazy.
Being a live donor has risks.
I looked it up. The risk is 1 in 4,000 I could die during surgery, which means if I don't donate, I'm valuing my life at 4,000 times someone else's. It's not like I want to be cut open and have a part of me taken out, but I've got 2 and this woman has none. She'll die without it.
Perfectly logical.
People with mental deficiency can be logical, just like sane people can be illogical.
This kidney thing is the only evidence you have that he's sick. I'm gonna let him be a donor.
Dr. House, it's not a symptom. Come back after you're convinced that I'm healthy and I will give you your money.
You won't.
Why is she here?
Because I called her. Bigger question is, why that worked?
I'm here because I have time and you have a crisis,
We're
and
too
I'm
busy for rationalizations. Patient made a big downgrade in his personal life. He's probably not eating all that healthy.
Magnesium deficiency?
Wait until they take him back to his room, draw blood, do an expanded electrolyte profile.
No, he hasn't had anxiety or any trouble sleeping. I think it's Whipple's disease.
Bad idea. He doesn't have joint pain.
Joint pain is common, but not definitive. Whipple's explains all of his symptoms, including the personality change, and it would respond to antibiotics, which is why he started to feel better, which doesn't mean he's not still sick.
You were right. Counts for nothing if you can't defend it. Book a procedure room, do an upper endoscopy, and run a PCR test for Whipple's.
There's no sign of tropharamadine. It's not Whipple's.
We did what we could.
You sure you want to do this?
Relax. This is going to make me very happy.
Dr. Simpson. Heart rate's 140, pressure's dropping. Get him adenosine, stat.
Patient's unstable, surgery's off.
Can I help you?
I'm his wife. We're separated. I heard he was sick. I just wanted to see him. He's giving a kidney to someone he's never met.
He wants to, yeah. I know he's talked about you. He's been alone all this time. I'm sure it would mean a lot to him to see you.
I wanted to spend my life with him, but I need to feel like he loves me more than other people. Like he loves our kids more.
I want to get Depo-Provera.
Actually, at your age, as long as you're careful, the risk of you getting pregnant is pretty limited.
Yeah, but it would calm me down, right? If I get a high enough dose.
You mean calm as in peaceful lake on a cool summer evening, or in the lesser used meaning of nothing can ever bother you again because life has absolutely no meaning. High dose of Depo-Provera will chemically castrate you.
Yeah.
Okay, I'm gonna get up to leave now. I'm gonna walk to that door, turn the handle, and then you're suddenly gonna decide that you have to tell me the truth. I'm gonna have to turn around, come all the way back. See, the thing is, my leg hurts. Can we cut the walking out of the equation?
I love cows.
Any particular variety? Guernseys? Holsteins?
Which are the black and white ones?
Oh, God.
I pass a farm on my way to school, and they're so beautiful. They're so majestic, I dream about them. Leather shoes, hamburgers. How can anybody do that to a cow?
Make love, not balance. It's beautiful.
I haven't actually...
Oh, relax. It's something we doctors deal with all the time. I'm gonna write you the name of a drug. You don't need a prescription. It looks just like Depo-Provera.
But does it do the same thing?
Oh, God, no. That stuff has all sorts of nasty side effects. It's real medicine. Now, this is all you need. Your frat buddies will be completely fooled. You tell them how appalled the doctor was. Lots of laughs.
I think I broke my ankle. I was kicked by a hoof. I'm so in love. She was so beautiful.
Which one?
One of the black and white ones. I'm not sure what type.
Which type? Which one? I want a name.
Why would it have a name?
Not it. She or he. I want to know her dreams, her hopes.
It's a cow.
Hey, I'm not the one who said he was in love. People who actually have this condition rationalize it. They dismiss it. They don't elevate it to the level of poetry. Plus, there's a wooden splinter in there. So either you hit yourself with a 2x4 or Elsie has a pig leg. I'm off duty at 6. Give yourself another whack. Come back and scam somebody else.
I'm sick. And you're a doctor. You have a duty to help me.
Technically, I don't have to treat anybody before running a series of painful and often humiliating tests.
Whatever you need.
Got your labs. Do you eat guinea pigs?
No.
How about hamsters or mice? Humans?
What are you talking about? Is something wrong with me?
Absolutely nothing. Your blood work is perfect. You got lots of vitamins, minerals, all kinds of proteins, including a little something I like to call bovine serum albumin, which you get from eating the animals mentioned. Or cow. You don't really worship cows. So I have to wonder, what could be more humiliating than someone calling your girlfriend a cow and not being metaphorical? Nice.
It's my mom.
Either that's a very old photograph or it's your stepmom.
She goes around the house in a bikini, or less. I can't stop thinking about her. My dad's in Europe. I'll be watching TV. She'll give me a massage. I can't walk for an hour.
Still. Cows.
She's my mother.
Step.
Please. I just need the medicine for 3 months until I graduate and I move out of the house. Please.
You're not gonna have any fun at graduation. You're up early?
Cuddy needed a consult.
We're checking for spinal lesions from leukemia.
Yeah, I know. Fits perfectly. Unless this is the patient with the anaphylaxis, the heart failure, and the paralysis, in which case you're wasting your time.
We want a second opinion.
Second, to give you at least 8. Okay, well, here's 9. Botulism. Listen to me. Have you eaten anything abnormal? Any canned foods?
No.
You sure? Lying to your parents is usually the right thing to do, but there's an impending death exception.
Don't talk to her like that.
You're right. She never lies. I was being rude. When your boyfriend snuck in on Friday night. Surprise. Perhaps he got you some sexy little treats, huh? Some honey or some edible underwear, some massage oils. Come on, anything. We know about the sex. That the Danny's little Danny is full of penicillin. That's what caused your anaphylactic shock.
You didn't tell us that was...
No, it was each-clindamycin, what I use.
He said he was on penicillin.
I saw the bottle.
It's a non-penicillin antibiotic.
The antibiotics didn't cause the anaphylaxis.
Still on the table.
Everything is connected.
What did we discuss? What was the differential?
Cameron said... When Dan came to your house that night, did you go through any tall grass?
On defense.
What are you doing?
Your daughter had 2 visitors on Friday night. One of them is still in the room. He has tick paralysis. Dan tracked a tick onto his jeans, which wouldn't be a problem, but being a teenager, Dan couldn't keep his tick in his pants.
We already checked her.
Well, now I'm checking her.
Tick bites don't ordinarily cause anaphylactic shock.
This girl's allergies are not ordinary.
House, get out of here. We have to re-intubate her, get her into the MRI.
The time course is perfect. Bite itself sets off an allergic reaction. Then it takes 4 days to kick in. Heart's vulnerable, it hits that first. And a day later sets off the ascending paralysis.
Except that ticks aren't usually invisible.
They are until you find them. Oh, that's dandruff. Okay, well, that wasn't nearly as dramatic as I'd hoped. It just means the next time will be even better. There are 20 words to describe chest pain. Burning, squeezing, stabbing, tearing. Each one diagnostically useful. For that, you have to thank Dr. Powell's textbook. But there are no words to describe degrees of what he's feeling right now. Shortness of breath. If he had worked on those issues, there would be. So he never would have given up until he had an answer.
This isn't working.
Dr. House.
Please don't get up. I'm sure you're very busy. So I'm just gonna try and speed things up a little.
Is that epi? That's not the protocol.
No, the protocol is what you tried to do and failed each time. Over 100. Now we're getting somewhere. How's it look, Foreman?
No EKG changes.
Push harder.
House, you're gonna kill him.
No, he's right. Let him do it.
See? That's why he doesn't have to wear knee socks.
He can't breathe.
130. Our magic number. Nothing here. Foreman?
Still no sign of blockages.
Which means it's not the heart. It must be the lungs. See? Was it so hard, was it?
No, just give me the rest of the epinephrine.
Test is over. It's okay. We're gonna stabilize you.
No. No, just let me die.
You're not gonna die.
Yes, I am.
We'll find a treatment.
I don't want to live like this. Please, I'm begging you. Kill me.
What happened?
I don't know. Must have fallen out of bed and got the nasal cannula wrapped around his neck somehow.
Ezra, what are you doing?
I don't want to live hooked to machines. Too weak to wipe my own ass.
Why would you want to wipe your own ass when you could have someone do it for you?
You're wasting your time. There must be other patients you could actually help.
No, all services rendered on a first-come, first-served basis.
I won't consent to any more tests. And if anyone tries to so much as touch me, I'll press charges for assault.
Okay, well, you heard the man. He wants everyone to leave him alone. Why don't you go first? Get out! You came to me. I didn't come to you.
Figured you'd have the guts to do what had to be done if it came to that.
We're nowhere near that. It's time to test your lungs. Breathe. You're gonna have to exhale sometime. Stop.
House, you're hurting him.
You're hurting me. Fine. You don't help us, we don't help you. Your lungs slowly fill with fluid. You gasp to catch every breath, but never can. Every breath is petrifying. It'll be slow, painful, torturous.
We don't choose our birth, and we don't choose our death.
What if you could? How about we make a deal? Give me one more day. If I don't find out exactly what's wrong with you by then, I'll help you die.
House.
24 hours. Come on, it's not gonna kill you. Wow. You guys look like crap. What do you got?
Purple dye on my fingers.
What'd the bone marrow biopsy show?
Don't have the results.
What? What have you been doing all night?
Jello shots and wild sex. What else?
There's no bacteria in the blood cultures. We still have some cooking, but so far, nothing. Nothing in the urine.
Lab was cleaning up to do surgery in because, well, they do. There was no sign of viruses or fleas on any of the rats.
Yeah. Who? Well, tell her to call a clinic. Then tell her to leave a message and I'll get back to her. Then tell her to leave a personal message.
Who's that?
Your protege. What are these?
Dictation tapes. He records everything.
Why?
Because he's a diligent researcher?
Or he's losing his memory.
A lot of people dictate their notes.
Yes, we could assume that and we'd have nothing. Or we could assume it's a symptom, in which case whatever's in his lungs is also in his brain. Unless you got something more promising.
I'll go get an MRI of his head.
Everybody who can walk should get out of here.
You can't do that.
Can't do what? Administer a prescription painkiller to a patient who's in pain? Go. Make sure somebody sees you downstairs in the cafeteria.
I can't let you do this.
Either I die in pain or I just die. That's what the argument is here.
No, it's about whether you die or we murder you.
What's gonna happen here is that someone's getting a buttload of morphine. I'm not sure exactly who at this point.
Can't be a part of this.
I always wondered exactly what was on the other side.
Nothing.
What are you doing?
Getting a laryngoscope. Don't just stand there. Help. But you told him that. It's something I like to call a lie. Bad, I know, but it's way further down the list than murder. He's unconscious. No more whining. Keep testing him. Go get a ventilator. I'm gonna do this all night.
Kawasaki's either. What's next?
Congo Red.
Amyloidosis?
What the hell else would I mean by Congo Red?
It's not on the list.
There's no reason for it to be on the list.
An abnormal protein is building up inside the cells of his body, shutting down his organs one by one. Explains everything. The infiltrates on the x-ray, bone marrow, kidney failure.
We rejected amyloidosis because it didn't fit the first symptom we found. It would affect his heart.
It did.
It wasn't on the stress test.
We didn't push him hard enough. Add the stain. Let's find out.
Congo Red added.
changed the polarization of the light already.
That means it should be treatable.
How the hell you pull that out of?
Not out of mine. I had a muse.
Oh, God. Protein type AA.
Dr. House.
You have amyloidosis. It's in your lungs, kidneys, bone marrow, and brain.
Why should I believe you now?
If I was lying, I wouldn't tell you the subtype is AA. It's terminal.
Congratulations. Got your answer.